Also new tonight, more than 25 million Americans suffer from chronic pain. This is according to the National Institutes of Health. Here in New York State, a recent change to the medical marijuana program could offer a new pain treatment option. News 4's Jen Shantz has been looking into this. Jen?
Well, Jackie, in early December, the Department of Health announced chronic pain can now legally be treated with medical marijuana. This is huge for the program and for its patients. To put this in some context for you, in Colorado, more than 90% of its medical marijuana patients are being treated for chronic pain. So you can imagine how much this could expand the program here. But there's something else to think about, dealing with another crippling problem, and that's the opiate epidemic.
This is a game changer.
Director of the Dent Cannabis Clinic, Dr. Laszlo Mechler, has to find out how to accommodate a massive influx of new patients. He doesn't have a day off as it is, but he's expecting his calendar to get even busier. Since the state's Department of Health added chronic pain as the 11th indicator for medical marijuana treatment, Mechler says he's waiting for the floodgates to open.
We expect the numbers that we have presently, which are significant, to increase by 6 to 7-fold.
Thankfully, the state also recently announced nurse practitioners can certify patients. The Dent Cannabis Clinic has 9 medical professionals who can certify for medical marijuana use now. That will go up to 35, helping to balance the load of expected new patients. This massive binder is full of them, the majority seeking help for chronic pain, which before a couple weeks ago couldn't be treated with marijuana. Lisa Valley's daughter, Maya, is a patient of Dr. Mechler's. She has a rare form of epilepsy, which was approved for medical marijuana treatment from the start.
She was on asthma medication, acid reflux medication, the 2 pain management medications, and she has a prescription, a pharmaceutical drug for her seizures, and the medical marijuana. Since we introduced THC into the picture, I have been able to take all of her other medications away. The only medication that she's now on is her 1 seizure medication, which she's on a low dose of that, and the medical marijuana.
She's been using it since the state rolled out the Compassionate Care Act last January.
And there was a time where you really couldn't even hold her. She didn't want to be touched. She didn't want to have anything really around her because everything was painful.
This is Maya now. In addition to her laundry list of medications, she was on opiates to control the pain she suffered as a result of her conditions. She was also on an antidepressant.
She has been on Prozac for probably 4 years. I mean, who would want to give their 5-year-old Prozac?
Lisa gave Maya her last dose of it this month. Like many medical marijuana patients, Maya's dependency on opiates seemed to fade away after introducing marijuana into her treatment.
When I saw firsthand my daughter's pain ease by her very first dose, I was completely amazed and knew that that had to be part of the program because it could help so many people.
Dr. Mechler cited a study out of Michigan which shows the legalization of medical cannabis is linked with an almost 25% drop in opioid deaths across several states in the U.S.
Through history, we've known that medical marijuana decreases the use of opiates. There's studies that have been done that medical marijuana has an analgesic component, meaning it treats pain, but differently than narcotic, different receptors in the brain and in the body. So we know it's safe, it's not addictive, and it works.
Mechler is so sure it's safe, he often shows this slideshow during his lectures. It shows how dangerous marijuana, both medical and recreational, can be. Less dangerous than peanuts. There have never been any documented overdose deaths linked to the drug.
In the midst of an opiate epidemic in the United States, and especially Western New York, this is something that will relieve the pressure that physicians feel, because as you know, we have mandates that state we have to document pain in a hospital setting and an outpatient setting.
And here's the problem. You can't really prove pain, not medically.
Physicians by nature are compassionate and have empathy. So they trust every patient that comes in and say, I'm in chronic pain. How do you prove chronic pain? By a chest x-ray? Doesn't work that way.
Overprescribing has often been blamed for the opiate and heroin problem in Western New York. Many heroin users say they got started on pain pills. This new avenue, Metchler says, will, in a sense, let patients and doctors off the hook and give them a safer alternative to feeling better. There's more than 11,000 medical marijuana patients registered with the state's Department of Health right now. Metchler predicts that will skyrocket up to 200,000. Now, you've heard from one doctor, but keep in mind marijuana, even for medicinal use, is still federally illegal. In fact, it's in the same category as LSD. So getting government funding to study it is really challenging. There is a second part to this report. You'll hear from an addiction expert. Is medical marijuana the golden ticket for pain? He'll weigh in. Plus, Dr. Metchler talks the business side of the Compassionate Care Act and how this could impact dispensary shelves, which right now aren't very full. The part 2 of this report can be found on our website exclusively online at WIVB.com.
Good. Hope people will go and look for that because there's some interesting answers in part 2. But one thing I want to ask you is about the cost of medical marijuana. We've heard from these families it is very expensive. What about that?
The cost has been an issue since day one. Because it's federally illegal, insurance companies won't touch it. So all these families are paying out of pocket. And Lisa Valley, who we spoke to many times, she pays around $800 a month for this, all out of pocket. And Dr. Metchler feels that the more people who want prescriptions for this and the more doctors who grant them, that could drive the cost down. But of course, that'll, is yet to be seen. That'll take some time to happen.
If demand goes up.
Sure.
Okay. All right. We'll keep an eye on it. Thank you, Jen.